Greetings
what's going on.
and welcome to our live broadcast. I'm Dora Barilla, the Group Vice President for Community Health Investment at Providence. As a reminder, information provided during this event is for informational purposes only. If you have any medical questions, please reach out to our primary care or healthcare professional. Now let's begin. And now it's my great privilege to introduce my guest to you today. Joining me during this live event will be Christina Kennedy, Vice President and Community Relations Coordinator for High Desert Second Chance, Don Quigg, Community Relations Coordinator for Victor Valley Rescue Mission, and Louise Yepes, Wholesale Recovery Program Manager for Food Forward. Wow, you all have just been doing some incredible work up in the high desert, and I just really want to commend you, especially during this time, during COVID and all the challenges that we've been having with food insecurity. I just want to personally thank you for your commitment and your mission to our community. But I want to start by hearing from you guys first. Please tell me a little bit about yourselves and your role within your organization.
Would you like me to go first?
Sure, Tina. How about that? Would be great, Tina.
Hi, my name is Christina Kennedy. I am the Vice President and Community Relations Coordinator for High Desert Second Chance.
Tina, what is it that you do?
Oh, Lord. I do program operations. I'm the grant writer as well. I am co-lead with David here, one of our board of directors for our stats. So we collect all of our stats and data. So we record that as well. But there's like many hats that I wear. Amongst them is a mother of 6 children. I'm married to my childhood sweetheart. So we've been together for 32 years. Yay!
Wonderful. Thank you, Christina. And Dawn, tell us a little bit about yourself and your role within your organization.
I've had the pleasure of being at Rescue Mission Alliance, Victor Valley Rescue Mission for the last 5 years. And my primary role is community outreach. And that takes the form of what we do in the mission in regards to outreach to our community through our feeding programs, through our mobile shower units, through our various large outreach events where we take care of our low-income and no-income neighbors and friends, and our life recovery program house that has 20 beds. And it's a 9-month program with 2 years transitional living. We also do a lot of upstream work. That's a lot of my job. I work with several organizations on housing issues, food insecurity issues, homeless issues, so that we offer solutions, because at the mission, we are ministering to those affected by not being able to perhaps link in quickly to an upstream solution. So we look at a holistic approach to the people that we serve.
Wonderful. Thank you, Dawn. And Louise, tell us a little bit about your role and your organization.
Well, I basically am the Wholesale Recovery Program Manager. I've been working in food recovery and food distribution, and then basically, I've been a food rights activist. I've been working as a volunteer for food equity since I was basically straight out of high school. I had several roles as a volunteer for approximately 10 years, and about 14 years ago, I started working in food recovery with several organizations, initially as a volunteer, and eventually it became my job about 10 years ago. We founded the Wholesale Recovery Program at Food Forward in 2014 with the goal of removing supply barriers for nonprofits. We recognize that food distribution organizations are really great at knowing their community and knowing the needs of their community and how to distribute the food within their community, but they have limitations when it comes to transportation and the ability to procure produce, we focus 100% on recovery in fruits and vegetables, because we recognize that they are the most important when it comes for to be able to have well-adjusted, productive people that are well-nourished. Um, and we started the program very basic with in the beginning, it was just me. I was the driver, the manager, the accountant, everything. And we've been growing since. And when the first year, we started by recovering approximately 4.3 million pounds.
Wow.
Last year, we recovered 25 million, close to 25 million pounds. Uh, and our uh, and our focus is mostly to find organizations that know their communities and provide them with the produce they need to be able to serve them. So we are like the procure. We basically procure the produce for several organizations. On a personal level, I am I grew up being a diesel mechanic. I'm an operatic tenor.
Ah,
I studied to sing opera, and I've been a published poet in 3 languages in
wow. That's pretty incredible, Louise.
That
That's
is one
pretty
thing I did
incredible,
not know
Louise.
about. That is one thing I did not know about.
Thank you.
Yeah, no, we appreciate that. So, as you guys know more than anybody else, but just for our listeners, you can imagine that, due to COVID, that there have been many people who are food insecure this year. And, in the most recent 2020 household pulse survey for the census, some of the data in July that was showing 12% of Americans lived in households where either someone, didn't have enough to eat in the last 7 days. And you think about that and, and just the increase that has, probably happened over the past year. So we'd love to hear our listeners to hear about what are your organizations doing to really help meet this emerging need in our communities. Dawn, you want to start?
Sure. Early on, and this year it was fascinating that it came up this year. We really were looking at the Pantries for All. And if you look at the front page of our website, you'll see as you scroll down, that's one of the main things we talk about, Pantries for All. Not realizing that it would come to even being more needed because of COVID-19. Due to the diligence at a High Desert Second Chance and the fact that we are a collaborative, we're an MOU-driven collaborative. And so all of our organizations sign an MOU to be a part of us.
And Dawn, for our listeners, you could define what an MOU is.
It's a memorandum of understanding, and in it defines their relationship to us and how we cooperate together. And it allows us as an organization together to look for resources. And because we are 73 feeding agencies strong, it allows funders and large organizations like Louise to feel comfortable with the fact that when they are delivering, we are delivering out to our communities. So the pantry system has been of major importance. We've done a lot of advertising and getting the word out. We already were at 12% food insecurity in our area going into organizing our food collaborative. And so we've been looking at some data, and in March, United Way in Hesperia went from 37 to 103 calls for food, and now it's back down to under 30 as of August. So us getting the word out together to the feeding that we do has across the board in our area reduced calls into 211 because people are now beginning to understand where to go to get food, and it's really given. Tina will talk that even the farmers to families, we've gone from the initial shipment of 2,500 to over 10,000 a week. And so that's going out all over through our high desert. And so that is how we do it. We get the information out, we get it through our partners, we collaborate together. We have a centralized location that people feel comfortable giving food to, knowing that it will reach. And Tina can talk about later about just the data they've seen at High Desert Second Chance alone, which is very revealing.
Yeah, that just goes to the power of the ecosystem that you guys have created, that local feed ecosystem that can be adaptive and responsive to the needs, which is powerful. And you just can't replicate that outside of being on the ground. So thank you. So Tina, tell us a little bit about what, how you guys are responding and how your organizations are working together.
Well, since the COVID period, since it started in March, within the first 30 days, there was a 500% increase in demand for our services. And that was across the board through all of our partner agencies as well as us. And it was a unique situation because within that following month, Farms to Family started. Mm-hmm. So we were able to work with Luis, with Food Forward. We were able to work with the Blessing Station, Inc., in order to get that additional food supply. We went from 2019 with 53 feeding agencies and adding on another 20 additional feeding agencies in order to meet the demands. Part of what we do as the lead for the collaborative is to find red zone areas. Red zone areas to us are areas with the least amount of services, with the least amount of ability for people to reach fresh food, fresh produce, markets within a 2-mile radius. So what we do is when we're adding on these additional organizations, we're looking for those red zone areas because we don't want to flood a specific area where there is more than enough services provided. And then we were able to see, and part of it was through 211 with their reports, but we were able to see by August, the 500% increase went down to 115%. A lot of it was accounted to the monthly multi-city wide distributions that we've been able to do. We've answered the need for Victorville, Adelanto, Bakers, Barstow by sending out supplies on a monthly basis that we deliver to hold citywide food distributions in order to meet the needs and the demands for the services in those areas. We continue with the Farms to Family program, which is going on till the end of this month, October. And then, but in the process, we are already planning for once the Farms to Family is no longer available to us, because then there'll be a loss of that food supply. Huge revenue. We're getting about 300,000 pounds a week just from the Farms to Family deliveries. So once that's gone, we still have these 20 additional feeding agencies on. So what we're doing to meet that, to stay sustainable, is we're working with Mojave Water Waste Management, JPA, in order to start implementing AB 1826 and SB 1383, which is gleaning food supplies from local retailers. And that's something that we are working to do with our local retailers to match them up to the feeding agencies so that there is that additional food supply and that revenue coming in to stay consistent with our agencies that we currently have.
Wow. Again, incredible adaptability. You guys are really amazing me with that. So Luis, tell us a little bit about your role in all of this and how your organization fits in. And Luis, I think you're on mute. All right.
Let's see.
There we go. There you
There
go.
we go. Well, initially when we started the Wholesale Recovery and Food Forward, we wanted to designate communities that needed the food the most, that places where we could make the most impact by providing the food. I started having conversations with agencies in the High Desert back in 2016. I remember a meeting that I had with one of our initial agencies up there, Broken Hearts Ministries, and Kevin Mahaney from St. Mary's Medical Center, in which I proposed something that I had already been doing in LA County and Ventura County, which was delivering a full load of produce to a central location in which many agencies would be able to come and collect produce. And basically the only cost that had to be covered was the transportation cost. Um, and the culmination of that was ended up with the Hydrastic Collaborative. Basically, a central location in which we're able to send the produce that we procure and make it available to those in need, and where it would be distributed in a fair manner to the agencies, so they would all be able to have what they need. Um, uh, with the pandemic, I mean, we're already distributing. I think in the beginning of the year, a couple loads to High Desert Second Chance. It was once every 2 weeks, if I remember correctly, in the beginning of the year, and it very very quickly ramped up to about 2 loads a week.
Wow.
Yeah.
And actually it went to a little bit more, and there was a point in which we were basically sending basically as whenever we had enough produce to send extra, we always did.
Yep.
In our case, we work with approximately 2,000 agencies from San Diego County to Fresno County. Um, we have basically about 2,000 indirect agencies that we serve in Southern California. And our job is to be able to uh, basically procure enough food to be able to serve all those in need. So,
Wow.
with the pandemic, we saw our donations go up the first month by about 100%, and we know we did the best that we could to make sure we distributed everything in a fair manner. But after about a month, we saw our donations go down, just as the USDA box program came into existence. In the first two periods of the USDA box program, we were able to distribute approximately 1 million boxes,
Wow.
which was about 1% of the total boxes distributed in the United States.
Wow.
Yeah,
And
so we were, yes.
I just wanted to compliment you because we were taking delivery of the first 2,500. And at the mission, I began to get information from other distributors, and they were fully 3 weeks to 5 weeks behind the
Wow.
distribution that Food Forward was already in. And I was able to say, I'm sorry, we already saw the first distribution last week.
Yeah.
And so I just really want to compliment Food Forward being really on top of it and getting it out very quickly.
We,
Yeah.
we were very fortunate because we've been building relationships with produce vendors, wholesalers, for many years. I personally been working those relationships for about 15 years, with most of them, some even more. And we were part of the ground floor. We're basically part of the initial applications with some of the box producers, and we were the sole recipients of two producers for the USDA box program during the first two periods. Because we basically only focus on fruits and vegetables. So we were dealing, everybody that was focusing on creating those boxes, the fruit and vegetable boxes, came directly to us because of our reputation and our ability to, basically to execute what we promise we
Yeah.
can do.
That's
Uh,
amazing. That innovation I mean, you guys just saw the need and you met it. That is just absolutely phenomenal. No grass grew under your feet to make sure that the communities were served. So, I'm curious, I mean, Christina, you were talking a little bit about some hot spots, areas of, I'm assuming those are areas of high need. And you're probably seeing, in food is your basic tendency to life, but we're probably seeing some other needs. So I'm just curious about other, were there other partnerships with community, or what was the evolution of some of those relationships?
Well, I just recently did a grant for Albertsons, and one of the questions they asked was, how is your collaboration unique, and how are you able to do what you do? A lot of our collaborative partners are community service providers, or they provide some type of service that is much needed in the community. So we have partners that do utility assistance. We have partners that do housing assistance, hotel vouchers, bus vouchers. Rescue Mission does many of those services themselves. What we have done is, as a network system of 73 agencies, we work together to share that information. If we have a specific client that is in need of a service, whether it is housing assistance or utility assistance, we know where to refer them. But it's not just a referral. We contact our partner agencies. We let them know who's coming over. Not only that, as the hub for the High Desert Food Collaborative, we have opened up space on our site for our partner agencies to hold these classes, informational classes, whether it is health and wellness, healthy cooking, utility assistance, flu shot classes. We have St. Joseph's that will be doing, St. Joseph's and St. Mary's that will be doing a flu shot class. We have Ready for Reading, which is one of our partners, do a children's class for pre-K or preschool students to be able to get booklets and school supplies. So what we do is we encourage our partners to grow and to get that information out. And by doing that, we hold our site open to our partners to hold these classes here so that this information is ready available. Not only that, many of our partner agencies are small and they do not have that facility to hold classes or to be able to share that information unless they're at an event or unless they are invited to another site location to do it. What we want to do is keep it consistent so we have our partner agencies booking classes on a weekly basis. And it's open Monday through Thursday. They're able to book all day long, how many hours they need. We have 2 open offices where they're able to share that information. And it's been, for the last 4 months especially, the spike in interest in those classes is huge. Right now, we're holding a class today with Azusa Pacific and Ready for Reading, 2 different partner agencies that have combined their efforts to work together. And it's something that I say is very unique and innovative of the High Desert Food Collaborative. You don't see that often with a food bank. And it's something that's interesting because we are a food bank. Yeah. But I also say, our collaborative partners are stakeholders. Yeah. In our organization, they are actual stakeholders. They have the say, they have the ability to decide, they have the ability to grow along with us. It's not just going to be High Desert Second Chance growing. The partners are supposed to be growing with us. And that's something that's unique and innovative about the High Desert Food Collaborative.
Yeah, well, I would disagree. You're probably not just a food bank. I see you guys as community. I mean, you're truly building community, and that web of trust is invaluable, especially during these times. Don, were you going to add to that? And I also, if you could just add one other thing to your response is, as you guys seem to really have your finger on, the pulse of the community. So, what are the greatest opportunities as well with some of those partnerships for, just leading into the emerging future?
Well, one of the things that I think that is a strength about the collaborative is that from the very beginning, we did not just, we planned for success. And what I mean by that is we look at the agencies that we add and we make sure that every time we add, that agency will be supportive just as much as any other agency. So we tried not to outgrow supply. We tried always to match supply with demand so that when an agency joined us, they could trust that they would receive what they needed and what we had promised. And so we've had a waiting list. And we would love to not have one, but that is just part of just doing good work. The other thing is getting out into the community. And what I have really loved about my role is that I've had an opportunity, and along with Tina, lots of times we go out and we talk about food insecurity and the collaborative, such as we are doing today. And then Tina goes back and she really concentrates on what's going on in the food bank. Whereas my position has been more of, I'm on the Homeless Solutions Task Force, but I represent food insecurity on that task force. So I have an opportunity on different committees I serve on that are part of my position here. at the rescue mission to be able to advocate for those things at different levels among the community. And then that's how we're able to ascertain the gaps,
Yeah.
like what Tina was talking about. And we're able to speak into them so that people are aware that maybe some of those gaps don't have to exist. This is already here. And one of the cooperative things we're doing is with 211 is creating a centralized food pantry list that we're updating that is countywide, but then one that's specifically designed for the high desert
Yeah.
so that you can go right there. You can know right when, how, what day, who is the contact, what you'll receive. And then that also helps the flow information so people can obtain food.
Yeah. Dawn, that's such an important point that, there already are often, collaboratives and efforts going on in the community. And really it's important to identify those and feed them and nourish them so that we're not, recreating something that's already growing. And so thank you for pointing that out, because I think that's so key. I know last night I was, just at my local grocery store, and, they said, would you like to do, donate the $10 for the food bag in your local community? And it makes you think, well, what am I doing enough? I do a lot at a national and, with my role in Providence, but am I doing enough? And so, Luis, I know this might be a loaded question, but, what can, people that are really concerned about their neighbors and their communities that are experiencing food insecurity, what can we do to help?
Well, what I would say and what I always say is obviously direct any monetary donations that you want to make directly to the agencies that are providing the service. But overall, I would say, and I know this might not be possible now, but when I started doing this, the way I saw myself making a difference was through volunteering. I my what I'm doing right now is a direct result of what happens to a high school kid that decides to volunteer. Because I've been volunteering my whole life.
Thank you.
And if it wasn't for that, I wouldn't be where I'm at. I started working for causes that I knew were important, that I felt were important. I remember I used to feel like I might not have the resources financially to be able to help, but I can definitely work. And do not feel that you cannot help, because you could always help by working. Your work and your energy is more valuable than any money that you could provide.
Thank you for that, Luis. I want to, just really ask, how do you guys see yourself apart? I don't want to say healthcare, but, as Providence is a healthcare organization, and our vision is to, look at health for a better world. But how do you see those, relationships and collaborations growing over time?
I mean, we have several relationships with different healthcare entities. We work with Venice Family Clinics in the city of Venice, California. We work with the Inland Empire Health
Health plan.
Health plan. We have worked with with Aetna. We work with sometimes with Kaiser, with different providers. We see ourselves as being able to provide food that is nutritious, that is actually beneficial to those people with chronic health conditions, and food that is able to provide nourishment for kids that need to grow well adjusted and be able to deal with the everyday challenges that life provides. It is very unfortunate when kids have to struggle but because they ate the dollar burger in the corner, or they ate nothing but ramen noodles the whole day. So what we're trying to do is we're trying to provide the correct nourishment, so we create well adjusted growing individuals in the society that will be able to handle the challenges that life
Yeah.
provides to them, brings to them.
Thank you, Luis. And unfortunately, that we could go on talking about this for a long time. We're about out of time, so I want to give you guys 10 seconds if there's anything you want to add, and then I'm going to do a wrap up.
I would love to add on to that last question. What we see as us growing with, especially with the health foundations, is that we are looking to work with them and build the relationship as far as our local hospitals that are seeing a lot of our seniors, a lot of families that are coming in there that have been affected by food insecurity. They're either malnutrition or something that's related to malnutrition that has caused another illness. We want to be able to work with those emergency units to sit there and have them refer their clients over to us and make sure that they're aware that there are services within their community. That's something that we really want to build on.
Wonderful.
That is what we currently do with our classes, with all of our different our partners that are doing it.
Thank you,
and,
Tina.
and advocacy is a great tool.
It is.
Unfortunately, sometimes we're so busy trying to make sure we get the food on, on people's tables to be able to do it. So we rely a lot on the healthcare organizations such as yours. So thank you.
Mm-hmm.
And let me thank St. Mary Providence. Your guidance has been wonderful. Your participation has been wonderful. And we've also been blessed with Dr. Lydia Garcia Usri from Azusa Pacific, who works with us on an ongoing basis and did her thesis with us on healthy outcomes of healthy food for food insecure. And it was just wonderful for us to have that guidance with her all along the way. And so we respect and thank you for what you give us so freely. We're grateful.
Well, I want to thank you. If anybody doubts if there's angels amongst us, you don't need to doubt anymore. What you guys are doing for the community is so inspiring. And we want to thank you, Tina, Dawn, and Luis, for all that you do and for joining us today. And to everyone who is listening and sending, your thoughts and questions in, we really want to, make sure that we're honoring and supporting the work that you guys do. To learn more about our initiatives, programs, medical services, or ways to give, please visit providence.org. For more information about the High Desert Food Collaborative, please see highdesertfoodcollaborative.com. And make sure you follow us on social media under Providence on Twitter and at Providence Health System on LinkedIn, Facebook, and Instagram. Again, thank you for joining us and have a blessed day.
Thank you.